I think the demand to have all of our documents, to know all of the health information, to be able to have all that information and present it at the time of your appointment is challenging.
We went to different hospitals and records were not sent with the family members. They didn't have access necessarily.
To carry along, you know, sort of their purse of documents from provider to provider is cumbersome. And if you are older, I think it's more of a challenge, or if you're dealing with a really complex health issue, it's overwhelming.
You have to fill out the same forms. You have to fill out the same, what's your medical history? What's your, have you ever had tuberculosis? Have you ever had a heart attack? Have you ever had asthma? And it is the same forms over and over and over again.
It does become a source of irritation to patients sometimes when they get asked the same thing over and over again. And so I think it's a much more efficient process if you can get the information once and share it.
I think it would eliminate errors that are caused by incomplete information. So I think it could prevent medication errors, I think it could prevent diagnosis errors, everything.
That notebook of documents that we carry would be in a nice record that's easily transported from place to place electronically.
We are talking about sharing information on an as-needed basis. We're talking about only using information in a way that has been authorized. Only in a way that has been authorized for the explicit purposes of providing care and improving the quality of the care that's provided to folks.
I think it also can help coordinate your care where you might be seeing a specialist and the primary care doctor needs to be looped in on what's happening. So it pulls together the entire care team.
I think if the doctors had all of the medical records available, I think they could give much better care. They would know what started. They would know when something took place. They would know if that might be pertaining to what's the current problem.
The biggest thought that comes to me about why you would want to take part in an electronic health record network is because it can save your life. If you're in a car accident or if something happens to you and they need your information quickly, the electronic health record is a wonderful tool in being able to give you timely care when you need it.
If a family member in my household asked me, should I sign up for this Missouri Health Connection thing? What is that? I would tell them in a heartbeat that they should sign it and they should be thankful that that access can be provided to their information because it can save their lives.